Every day, expert surgeons lose billable hours to consultations with people physically unqualified for treatment or harboring expectations based on digital filters. If a surgeon loses 5 hours a week to these no-go prospects, it creates a compounding deficit. Over a single month, those lost sessions represent thousands of dollars in missing revenue. There is also a cognitive cost. Repeating basic anatomical limitations to individuals who aren't a fit is an exhausting loop for a highly trained medical expert. Traditional open-door booking models end up penalizing the practitioner, forcing them to spend their energy as a basic educator rather than a specialist. A more efficient approach uses agentic AI, intelligent digital assistants that act as a pre-consultation barrier to intercept these bad fits before they reach the office. To build this system, you only need 2 components, a chatbot builder to design logic and a digital calendar link to manage the actual bookings. This creates an automated pathway reserved for Gold Star patients. These individuals are already vetted for their baseline health, their realistic budget, and their readiness to proceed. By treating the AI as a protective layer, a clinic can decouple their patient volume from the physician's personal fatigue. Success starts with a rigid system prompt. You must define 5 must-have criteria that the AI will use as its foundational acceptance logic. These criteria focus on non-negotiable realities, whether the patient is a smoker, their available budget, and seeking realistic physical results. By translating medical requirements into digital rules, you create a 5-pillared security gate that filters incoming traffic. The AI actively repels users who fail the baseline parameters, while perfectly aligned shapes pass through. A standard chatbot lacks the guardrails needed for a medical context. The system only works if the parameters are defined by the practitioner's specific requirements. One of the most common drains on a doctor's time is digital dysmorphia, where a patient expects surgery to produce the same look as a phone app. We solve this by programming a filter rule into the AI's instructions as an active intervention protocol. You teach the AI to ask, "Are you trying to look exactly like a social media filter?" If the user says yes, the AI is instructed to explain that real skin and bone don't function like pixels in an app. This allows an unfeeling machine to handle a potentially awkward conversation instantly. For a human doctor, delivering this same reality check requires significant emotional effort. Delegating these filter rule conversations preserves the doctor's authority and saves their energy for the actual medical work. Once the AI has the necessary data, it reaches a fork in its logic to decide the prospect's route. The red light protocol is for users with clear disqualifiers.